detrimental to the equine species has been introduced into North America. Even though this disease, the West Nile virus, has not yet reached epidemic proportions, the potential is there. It is important for horse owners to understand what this virus is, how it is transmitted, how their horse can be protected, and how to detect the virus and properly care for an infected horse. The West Nile is an eborovirus, or a virus transmitted by mosquitoes. It is an aborigine of Uganda and was first cited in 1937. The virus was first discovered in North America in New York in the summer of 1999. Since then, it has been confirmed in 18 other states. Since the West Nile virus was discovered, its occurrence in the equine species has grown more than twofold, according to thehorse.com, and is expected to become a full-size risk within a year or two. The transmission of the virus is difficult to contain because the main carriers of it are migratory birds that travel great distances. The transmission process begins when birds become infected. A mosquito will then become a carrier of the disease when it bites the bird. The transmission between birds and mosquitoes is a natural process which is difficult to suppress. People and horses can acquire an infection if bitten by a mosquito. The virus is located in the mosquito's salivary glands and is injected into the bloodstream and multiplies and intensifies. It then infects the brain, causing interference in the central nervous system due to brain swelling. Dr. Jennifer Bermer says that because the West Nile virus is so new to the area, natural immunity has not been able to build up, making prevention vital. To help prevent the disease, the following tips from Dr. David Roselle of Black Mountain Veterinary Clinic are useful in reducing the number of mosquitoes around a horse. Eliminate standing water in the yard because mosquitoes breed and multiply in standing water. Unclog roof gutters. Change water in buckets and other watering devices at least once a week. Remove old tires or any unused containers that might hold water and serve as a breeding ground for mosquitoes. Turn off lights that attract mosquitoes at night. Use fluorescent lights that do not attract mosquitoes. Plant a bat-friendly garden or a bat house to attract these natural mosquito-eating predators. There are also ways to reduce a horse's exposure to mosquitoes. Note the following suggestions from the Asheville Citizen-Times. Avoid unnecessary outdoor activity when mosquitoes are present, mostly at dawn and at dusk. Blanket the horse as much as possible or use a fly sheet and fly mask. Apply an insect repellent that contains 20 to 30% DEET and keep screens in stable windows. A vaccine for the West Nile virus has been approved and is an excellent preventative measure, given that it is effective. The vaccine is given in 2 doses, 3 to 6 weeks apart, and once yearly after the initial vaccination. Dr. Tom Locke of the Minnesota Department of Health, who enthusiastically uses the vaccine, says the only prevention from the virus is to vaccinate. The U.S. Department of Agriculture granted a conditional license to certified veterinarians for the use of the West Nile vaccine. Each dose is tested to eliminate the chance of the virus's survival in the vaccine. The vaccination enables horses to develop West Nile virus neutralizing antibodies. Studies of the true effectiveness of this vaccine, however, are still in progress. Many people are skeptical about the advantages of the vaccine because the true efficacy of the West Nile vaccine lacks extensive validity. One argument against using the vaccine is that scientists will have trouble deciphering between the vaccine and the virus in a blood test because they appear identical. Because horses with the vaccine would test positive for the virus, it would appear that they are carriers, and they will not be granted approval to travel to areas free of the virus, if quarantine regulations are ever instituted. Diagnosis of this disease is difficult because the symptoms experienced by horses that contract the disease mimic many of the symptoms of other viruses, such as Eastern, Western, and Venezuelan equine encephalitis. The disease is also tricky to diagnose because many of the symptoms are not analytical or obviously visible. Dr. Lori Fio identifies some of the more detectable symptoms which are linked with encephalitis. These include coma, stumbling or tripping, twitching, partial paralysis, loss of appetite, depression, impaired vision, wandering, circling, inability to swallow, inability to stand up, fever, convulsions, and lastly, death. Unfortunately, many other ailments such as rabies and other serious neurological diseases show the same symptoms, making the West Nile virus complicated to diagnose without a blood test. Veterinarians agree that there isn't a particular treatment for the West Nile virus. Accommodating therapy, however, provided by a veterinarian can lessen the severity of the disease and possibly keep a horse from death. An IV can be administered to keep fluids in the horse. Maintaining temperature and stabling the horse away from excessive noise and other horses is also beneficial. Antibiotics should be used to deter the threat of further infection. Recovery can take as little as 3 days or as long as a few weeks. Unfortunately, there is no way to ensure full recovery. The old saying, an ounce of prevention is worth a pound of cure, certainly holds true for the West Nile virus. The uncertainty of the vaccine and specific treatment make it vital for horse owners to take every preventative measure possible to protect their horse. Since its first sighting, the virus has begun to grow and will continue to spread. This virus is expected to become more of a threat as time passes. So horse owners should begin fighting it now, through prevention, before it's too late.